All right, today we are diving into a really fascinating medical mystery. It starts with one of the most common medications on the planet, and it ends with a discovery that honestly could save a whole lot of lives. So let me ask you this. What if a medication's most common side effect, the one that millions of people just kind of learn to live with, what if it wasn't a problem to be managed at all? What if it was actually a vital, life-saving clue from our own bodies? Let's get into it. Okay, so to really get our heads around this, we need to start with the basics. We're talking about a type of medication that is the absolute standard of care for millions of older adults, all for a really, really common heart condition. And that condition is atrial fibrillation, or AF for short. Basically, it's an irregular heartbeat. And its biggest danger, the real scary part, is that it can cause blood to just pool and form clots. And if those clots travel to the brain, they can cause a really devastating stroke. So, to stop that from happening, doctors prescribe what are called oral anticoagulants. You probably know them better as blood thinners. And make no mistake, these drugs are absolutely essential. They are a cornerstone of modern medicine and prevent countless strokes every single year. But here's the catch, right? There's always a trade-off. By thinning the blood to prevent clots, these medications also, you guessed it, make it easier to bleed. And for decades, this was just the deal. Doctors and patients just accepted this as a known, if sometimes annoying, side effect. And this, right here, is where the entire perspective just flips on its head. Researchers started to look at this whole thing differently, with this really powerful new idea. What if the blood thinner isn't creating a new problem? What if it's acting more like a truth serum for the body, just revealing a hidden issue that was already there all along? So, this brings us to the big question at the heart of this whole thing. Is this bleeding signal just an annoyance we have to put up with, or is it a critical alarm bell? And the scale of this is just huge. I mean, a major new study found that nearly 22%, that's more than 1 in 5, older adults who start taking these medications experience some kind of bleeding within 2 years. That is a massive number of people. And this got researchers thinking, really thinking. When a patient on a blood thinner comes in with, say, a gastro-intestinal bleed, is it just because of the pill they're taking? Or could that pill be unmasking something sinister, like a tiny, fragile tumor that was already there, causing it to bleed when it otherwise would have stayed hidden? To answer that question, researchers in Ontario, Canada, launched a massive investigation. They crunched the data from almost 120,000 people with AF over a 14-year period. Their goal was crystal clear. Figure out if there's a real, provable link between a bleeding event and a brand new cancer diagnosis. And what they found, well, it was truly stunning. It led to a major revelation about how we should be looking at this very common side effect. The conclusion was completely unambiguous. There is a direct and incredibly powerful connection between having a bleeding event while on anticoagulants and then getting diagnosed with a new cancer. This wasn't just some minor statistical blip. Just how powerful? Get this. The study found that a bleeding event was associated with a 4-fold higher hazard of being diagnosed with any type of cancer. To put it another way, your risk isn't just a little higher, it's 400% higher. Just staggering. But here's where it gets really mind-blowing. When the researchers looked at cancers that showed up at the exact same site as the bleed, the numbers went through the roof. A GI bleed, that was linked to a more than 15-fold higher risk of a new GI cancer. A urinary bleed, nearly 12 times the risk. Respiratory bleed, a 10-fold higher risk. The medication was essentially shining a giant spotlight on these hidden tumors. Now I know all of this sounds pretty alarming, but the researchers uncovered this critical silver lining in all the data, a totally unexpected opportunity for patients. And here's the twist that changes everything. The bleeding signals didn't just point to the fact that cancer was there, it seemed to be pointing to it at an earlier, much more treatable stage. It was acting like an early warning system. The proof is right here in the data. So, among patients diagnosed with cancer who didn't have a prior bleed, over 31% were found at stage 4. That's the most advanced stage. But in the group that did have that warning bleed first, that number dropped to under 28%. Now, it might look like a small shift, but trust me, in the world of cancer treatment, that makes all the difference. And why does this matter so much? Because catching a cancer before it reaches stage 4 can be the difference between a curable disease and a terminal one.
This bleeding signal, which we once saw as just a pesky side effect, is actually a golden opportunity for early diagnosis.
So, this all brings us to the final, and I think the most important part of this story, the call to action. If this bleeding is a warning sign, are we actually paying attention to it? Well, the study also uncovered a pretty significant care gap. Of all the patients who had a gastrointestinal bleed, fewer than 1 in 4 actually got an endoscopy to investigate the cause. That means 3 out of every 4 patients did not get this critical follow-up. And this leads to the powerful conclusion from the researchers themselves. They stress the importance of timely investigations rather than attributing bleeding as an expected adverse effect. The whole mindset needs to shift. A bleed isn't just an adverse effect to be managed. It's a diagnostic clue that needs to be followed. So what's the bottom line here? First, let's be super clear. These anticoagulant medications are absolutely essential for preventing strokes. But number 2, while bleeding is a known side effect, this research shows it should never, ever be ignored or just brushed aside. We need to treat any unexpected bleeding as an important message from our body. And most importantly, talk about it with your doctor right away. And that leaves us with one last, kind of wild thought to chew on. We spend billions of dollars developing these complex, high-tech screening tests for diseases. But what if, for some people, the ultimate early warning system is already there, hidden in plain sight, as the side effect of a medication they're already taking every single day?